Ready to dive deep into the world of prescriptions? Buckle up, because today we're exploring a curated list of some of the most commonly prescribed drugs out there.
Sounds intense.
It is, but fascinating too. We're going to be focusing on meds, starting with the letters O, P, and Q.
Interesting choice. Why those letters?
Well, we're pulling our info from Pasted Text, a list of the top 200 drugs compiled by Dr. Khaled Hassan for his podcast.
So we're cherry picking. I like it.
Exactly. It's a super efficient way to get up to speed on these medications, what they're used for, and maybe even uncover some surprising facts.
Can't wait.
Big shout out to Dr. Hassan, by the way, for putting this incredible resource together. All right, let's kick things off with the letter O. First up is Omalizumab, better known as Xolair.
A Xolair. Interesting.
Yeah, it's used to treat asthma. And I know monoclonal antibodies are kind of a big deal in medicine these days. What's so special about this one?
Well, think about those old inhalers, right? They kind of just spray medication everywhere, hoping some of it hits the right spot.
Makes sense.
Xolair is different. It's a monoclonal antibody, so it's super targeted. It goes straight for the source of the inflammation, this thing called immunoglobulin E.
So it's like a laser beam instead of a shotgun.
Exactly. Fewer side effects, potentially better results, a real game changer for people struggling with severe asthma.
That's awesome. Precision medicine at its best. Okay, next on the list for O is Tamiflu, the go-to for flu season.
Everyone's heard of Tamiflu.
Right, but does it really live up to the hype? Is it as effective as people think?
It can definitely help, but it's not a magic bullet. Tamiflu works by stopping the influenza virus from replicating, so it can shorten how long you're sick and make your symptoms less severe.
That sounds pretty good.
It is, but here's the catch.
There's always a catch.
It works best if you take it within 48 hours of getting sick.
So you gotta act fast.
Exactly. After that, the effectiveness drops significantly. It's not a get-out-of-jail-free card for flu season.
No skipping the hand sanitizer then.
Yeah.
All right, let's shift gears and talk about pain management.
Always a crucial topic.
Absolutely. We've got Oxycodone on the list, listed as Combunox and Percocet, a powerful painkiller, but one that comes with some serious baggage.
You're not wrong. Oxycodone is an opioid, so it's incredibly effective for moderate to severe pain.
Like after surgery or for chronic pain?
Exactly, but it's a double-edged sword. The same properties that make it so good at relieving pain also make it highly addictive.
Yeah, that's the scary part.
It's why it's crucial to use it responsibly and only under the close supervision of a doctor.
Couldn't agree more. Powerful medications need to be treated with respect. Now, before we move on to P, there's one more O drug that caught my eye. Omeprazole, better known as Prilosec.
Prilosec, the heartburn hero.
Millions of people swear by it for acid reflux. But is it okay to essentially turn off your stomach acid long term?
That's a great question. Prilosec and other proton pump inhibitors are really good at reducing stomach acid, and they're generally safe for short-term use.
That's reassuring.
But long-term use, that's been linked to some potential issues.
Like what?
Things like nutrient deficiencies and maybe an increased risk of certain infections. It's all about finding that balance between managing symptoms and minimizing risks.
So always a good idea to chat with your doctor about long-term use of any medication, really.
Absolutely. Informed decisions are the best decisions.
Couldn't agree more. Okay, ready for P. First up is penicillin. Talk about a historical game changer.
I mean, before antibiotics, people could die from a simple scratch.
That's terrifying to think about. Penicillin V potassium, it's the one we're looking at, really ushered in the antibiotic era.
It did, but its legacy is, well, it's a little complicated.
How so?
Well, you see, overuse and misuse of antibiotics led to this thing called antibiotic resistance.
I've heard of that. It's when bacteria evolve and become immune to the drugs that used to kill them.
Exactly. It's a major public health issue, and it means we need to be more careful about how we use these medications.
It's like, you know how sometimes you take an antibiotic and it doesn't seem to work as well as it used to? That's antibiotic resistance in action.
It is, and it's something we need to be very aware of.
For sure. Okay, let's talk about a drug that's not an antibiotic, but often gets used for urinary tract issues. Phenazopyridine or Pyridium.
Pyridium. This one's interesting.
What's so unique about it?
It doesn't actually fight the infection, but it relieves the pain and burning that comes with a UTI, like a pain reliever, just for your urinary tract.
So it's like, it doesn't fix the problem, but it makes it less miserable.
Exactly. Think of it like putting a cooling gel on a sunburn. It doesn't make the burn go away, but it helps you feel better while it heals.
Great analogy. Okay, speaking of powerful drugs, we've got Prednisone on our list, also listed as Deltazone and Rayos.
Prednisone, now we're talking.
It's a corticosteroid, right?
It is a potent anti-inflammatory. It can calm down everything from a rash to a serious allergic reaction.
It's like a superpower for your immune system.
In a way, yeah, but it's not without risks. Long-term use can lead to some pretty nasty side effects, so it's usually prescribed for short bursts.
So it's the big guns, effective but not an everyday solution.
Right on.
All right, on to our final letter, Q. You've got Quetiapine, also known as Seroquel, on your list. Another mental health medication, if I'm not mistaken.
You are correct. Quetiapine is an antipsychotic often used for schizophrenia and bipolar disorder.
Serious stuff.
It is, but it's also being used more and more for things like major depressive disorder, even though it's not officially approved for that.
Really?
Yep, it's part of this growing trend of using medications off-label.
That's interesting. So using meds for things they weren't originally intended for.
Exactly. It highlights how much more we have to learn about the full potential of some of these drugs.
It's a bit of a Wild West out there.
In a way, yeah. It makes it all the more important to be informed about what you're taking.
I totally agree. Knowledge is power, especially when it comes to your health. So there you have it, folks, our whirlwind tour of commonly prescribed drugs, starting with O, P, and Q.
We covered a lot of ground.
We did. You've got a deeper understanding now of what these medications are, how they work, and maybe even some of the controversies surrounding them.
Hopefully it sparks some curiosity, too.
Exactly. Imagine walking into your next doctor's appointment armed with this knowledge. You'll be able to ask better questions, be a more active participant in your health care, and maybe even impress your doctor a little.
Who doesn't love impressing their doctor?
Seriously. Keep learning, stay curious, and as always, don't be afraid to ask questions.
Couldn't have said it better myself.